All right. Good morning, everybody, and good afternoon for those on the East Coast and those coming in from Europe and across the globe. I remember the last event that we did, we ended up having the largest event in Plug and Play's history with over 1,800 people covering 65 different countries. So it's incredible to have such an incredible audience with us today. And the last event was the most innovative companies that we were seeing across the globe just as COVID-19 hit. And now what we're doing is taking the opportunity to look at one of the most pressing issues because of COVID-19, which is behavioral health and mental health, which is affecting just so many of us across the globe, whether it's us personally, our coworkers, our family, our friends, or just people that we know. So really excited to be talking about this. We just have an incredible panel as well as a fireside chat that we are going to be doing that will help everybody understand what they can be doing to be taking care of themselves, to be taking care of those that they care about, to be taking care of their employees, and also see what the future of behavioral healthcare delivery is going to be looking like. So it's going to be just an incredible 1 hour event coming forward that's relevant for a variety of different reasons. And one thing that's so important to us is when we look at our corporate partners, we have just an incredible vast array of different corporate partners, these 35 global corporate partners. Plug and Play, yes, we are an investor. We are the most active digital healthcare investor in the world. We've made 9 investments so far this year, 69 investments since our inception, including having our unicorn Garden Health, which made liquid biopsies possible. And we work with incredibly large healthcare organizations like Atrium Health and university hospitals, the top 5 largest pharmaceutical companies in the world, Pfizer, Roche, Novartis, Sanofi, Bayer, AstraZeneca. I think all of us are a little bit more aware of Pfizer these days because their COVID-19 vaccine is now in stage 3 clinical trials. And we're so proud of the team there and the incredible work that they're doing, and hope that those trials, of course, go well as the broader industry and government. BARDA, they're a division of the U.S. Department of Health and Human Services. That's actually how we got started on infectious disease work before COVID-19 hit. So we were fortunate to be able to have a leg up there. And then the logo just to the left of it, TRISH, the Translational Research Institute for Space Health. They are charged with the health of our astronauts. And what was so interesting to see there is when we're planning for the 2032 Mars mission, one of the main concerns is their mental health, because they're going to be in a very small room for 2.5 years for astronauts. And so how do they stay mentally sane? And we were talking about these things in July. And one of their largest missions is that the technology created for space can then be applied to the general public. And so it's interesting to see how when COVID-19 hit, all of a sudden we go into a shelter, and now the globe is pretty much now confined to most people confined to a small space. So it was very applicable what the NASA team was working on and the Mars mission, and how now we're all looking at that kind of technology. So it's been really amazing to see. And now as we go to the next slide, and we're talking about what today's event is, we're going to be having a fireside chat with Nikki Tessler, the Divisional Vice President for UHS. I've seen Nikki speak before on podcasts, and written some of her writing, and also gotten to know her personally. And she's just an incredible person. She's so engaging, and she also knows the space so well. So really excited for that fireside chat. And then an amazing panel discussion with Steve Bluemnfield from Willis Towers Watson, Valerie Photos from IASO Ventures, Daniel, a good friend of mine from Live Now, he's the CEO there, and Amanda Giddon from Monument, moderated by our fantastic innovation manager, Simon Maurer. and then we're going to be having a Q&A from the audience for the panel. And I think what's so amazing about the panel is every single one of them in their own right is incredibly impressive, knows their areas extremely well, and could be a speaker in their own right. But then also the diversity that each one of them brings, the different perspectives, is really going to make that very fruitful. So very much looking forward to that. And so with that, I'm so happy to go right into our fireside chat and speak directly with Nikki, Tessler. And what's so funny, Nikki, as you want to bring on your camera and your audio, is I know that Nikki is really popular, that she's so nice, but I didn't realize how popular Nikki is until last night on LinkedIn. I put like one last thing. Hey, if you want to register for this event, here's me and Nikki. We're gonna be having a fireside chat. And the just LinkedIn requests started streaming in late at night. I think it was like 7 o'clock Pacific, 10 o'clock Eastern. And all of a sudden, just an incredible amount of views, all these different. So that's how I really knew. I'm like, Nikki, it's not just Ava and I who really like Nikki. It's a lot of people who really like Nikki. So Nikki, it's an absolute pleasure to know you before this, to get ready for this with you and read your notes. And it's a pleasure to have you with us today.
Oh, I'm so happy to be here, Zach, and with all the Plug and Play friends. This is really exciting. Thanks for having me.
Yeah, of course. And one thing that I'm so excited to have this chat today. Today is coincidentally the birthday for my sister. My sister, she completed suicide about 6 years ago, 6 years and 2 months ago. And today would have been her 22nd birthday. And I was talking about it with my family today. And it's an incredible reminder, there's going to be probably more than 50,000 suicides completed just in the US this year. And it affects not only those 50,000 people, but everybody around them, right? And they start looking at hundreds of thousands of people significantly affected every single year. And I was looking at her Facebook earlier today, and she's still 15 in all of those pictures, but her friends who were 15 at the time, they're now 22. They're grown up, and she's still that same age in the pictures. And so it's very relevant for us to be talking about, as the globe is going through a tough time with their mental health. It's a fantastic reminder for me. And so, with that, Nikki, I'd like for you to just kind of give an intro about yourself so everybody can know how well you know the space and understand your expertise and how lucky they are to be hearing from you.
Perfect. So hi, everybody. I'm so excited to be here. Actually, very grateful. I'm a huge fan of Zach's. So this is super fun for me to be here today. So I'm a Divisional Vice President at UHS, and first and foremost, a huge behavioral health advocate. When I was thinking about the keynote to do with Zach, I couldn't help but think about Nelson Mandela, and he thought about that there's no purpose in playing small and settling for a life that's less than what you're capable of. Because for me, that's been the motto of behavioral health. One of the richest, as far as I'm concerned, and meaningful purposes on the planet. And so for me, I feel like I've had a front row seat to the value of behavioral health care. I've gotten to work with these extraordinary patients that honestly, you'd be lucky to know if they met with you on the outside world. And my own experience as having a therapist myself, and what that means in terms of the prize versus the devaluation of behavioral health care. And so for me, I keep wondering, why is it that cardiac is revered, or why is cancer treatments revered? And yet here we are looking at behavioral health and wondering, how do we capture, how do we create, how do we deliver the value that it deserves and is so worthy of? And I know firsthand of the extraordinary accomplishments of patients that confront themselves and that treasure of that relationship, and my own therapist, and how it's been an honor of my life. And so I want to figure out a way to bridge that gap, right? That disconnect. And I think right now, there's no magic bullet. We all know that. And as a collegiate soccer player, I kind of think about it in terms of a shots on goal approach, challenging the status quo, humanizing behavioral health care, and of course, changing the vision. And I'd love to talk with you guys about that today.
Yeah, that's one thing that, when I was looking at your notes, I found so fascinating, those 3 shots on goal. And you've framed that extremely well. As a soccer player, for you, you're trying to make a goal. Ironically, as a water polo goalie, I'm trying to stop the goal. But that's just for the ball. For today, I think we're both trying to get it in the net. And we had the first shot, which is to challenge the status quo. The second shot, which is behaviorizing or humanizing behavioral healthcare. And that third one is changing the vision. And let's start with that first shot on goal. Why does the current structure or the status quo, why does it need to be challenged?
Right. Well, and I would go so far as to say we must challenge the status quo because it needs to be positioned for, honestly, a sustainable tomorrow. And we all know, I don't think it's a secret to anybody that's watching, that the behavioral health sector needs transformational change. It's not working on a level of cost, and it's not working on a level of humanity. And like you said, there are incredible challenges when it comes to the declining and the uncertain revenue streams for the industry, coupled with the incredible operating costs and administrative burden. And so for me, I want to advance behavioral health so that we're no longer the underdog. We all know it's an age-old problem and that it's failing, honestly, to produce those outcomes we all hope for. Suicide is on the rise. There's an epidemic around loneliness that's confronting all of us. And just to throw more statistics at you, even though you started with some, 300 million people are suffering from depression. You're looking at 800,000 dying by suicide annually. In the US alone, about 17.7 million people are diagnosed with major depressive disorder each year, and another 48 million are managing anxiety disorders. And when you think about the alcohol and addiction medicine space, you're looking at 275 that are abusing drugs and about 3.3 million alcohol kills each year. And so for us, I think maybe arguably one of the more important stats is that 50% of patients never even engage in treatment in the first place. And that's a huge point I want to make today. The other piece is that behavioral health is the costliest chronic condition. We're losing about $200 billion in lost revenue or in the US, right? So I'm going to give you a perspective here, Zach. You could take all the NFL teams together and you would still have $68 billion left over. And that $68 billion you could then spend on all the lost money the American businesses have when it comes to poor customer service. So for me, I think the other part is that we keep looking at the barriers, but I want people to come around to the human issues and feel responsibility, but like in your gut to address it. Because I don't think we can meaningfully transform it as business as usual. And I want to say a positive, a silver lining stat, since I've given you some pretty negative ones. And that is that the digital health market in and of itself is projected to actually reach and exceed $500 billion by 2025. And so let's keep the optimism and the hope. And what I want to see all of us do is break free of those diminished expectations of behavioral health. If we just see it as merely ordinary, we're not going to be able to get to the extraordinary ideas that can emerge that we could all use. And for me, that piece has been the hardest work I myself have ever loved, to show everybody what behavioral health can be. Not where we are today, but what tomorrow is.
And we're going to get to that. And I'm happy that you brought that up. I actually know that same stat. It costs our economy $225 billion per year, right? 200 plus billion, 225. That's the one I saw. And I'm thinking here, and I'm sitting here thinking about a ton of just inappropriate Cleveland Brown football anxiety, depression jokes that that team always gives me. But moving on to the second shot on goal. humanizing behavioral healthcare. Why now? Why is now the time that we can really have an amazing change that hasn't happened in the past, like we have seen with surgeries or any other area?
Yeah, so right off the bat, let's talk about the pain points and the opportunities, right, of that COVID brings, and honestly, the push for racial justice, right? So what's going on in this world today collectively, honestly, is increasing the demand for what is a very scarce resource. And it makes for a perfect dynamic for us in the market, in the behavioral health marketplace, to really accelerate this field. And there are three drivers. There's no doubt we're in a mental health crisis in the country. But the good news is there is a shift that we're seeing in reducing stigma. And as a result, you're seeing an increasing demand and speaking of demand that has been so long overdue. And the third is, you know, all the great people out there, we've seen an uptick in the needed solutions, right? People are investing in this underserved market, which is terrific. But the ethical conundrum that we are in, I think, is that we have got to humanize behavioral health care. And when Viktor Frankl first talked about this, it was about the idea and the notion that if we saw ourselves, if we saw others as what they should be, they become what they can be. And to me, that translates right to behavioral health. If we make behavioral health what it should be, then it will become what it can be. And I think everybody should just allow that to register for a minute, because honestly, human behavior, the most intriguing part is not about the average. It's really about the improbable around that, you know? And so as you look at the racial justice and you look at COVID and where we're at in terms of this juncture, behavioral health plays a very important role in that. And first and foremost, we need to catalyze change, and we need to figure out a way where we ourselves are not just preoccupied on what were the worst things that are going on, but also about individuals and communities that don't just endure and survive, but also that they flourish. We got to build those positive qualities. And there's two reasons for that. The first is obvious. The first is that well-being in its own right, right? We deserve, we desire, we want. The second point is that it actually can serve as maybe the best weapon for mental disorders. For example, when somebody contemplates completing suicide, the answer is not just to cure depression. You need to also think about what the positive reasons for living are about and focus on that. And so we have rudimentary ideas right now around schizophrenia and depression and what that looks like from a neurochemistry and a pharmacology standpoint. And we also have reasonable ideas about brain loci, right, and pathways, whether it's OCD or anxiety or depression. But what I think we haven't thought enough about and observed is all those pathological states have an opposite, right? So what would the anatomy or the neurochemistry look like if we thought about courage or compassion or good cheer, or actually look at celebrating difference? And so, you know, I think at the end of the day, people say to me, are you sure this isn't pure fantasy, Nikki? And I'm going to say to you that it's gone are the days to think behavioral health is just remedial, an underdog, a victim. Right now, the time is come for behavioral health. And the epic giant, civil rights giant, John Lewis said it best when he said, we may not have chosen the time, but the time has chosen us. Right now, we can make a scientific monument for behavioral health, a science with primary task understanding what it takes for a life worth living.
And those are amazing closing thoughts. But you said something earlier that's a really fantastic point that I think we should dive more into, which is 50% of people never actually seek care who need it. And I think you're friends with Stephen Hayes of What If Ventures, and I think you're going to be on his podcast. I think that's like tomorrow or sometime soon. Maybe it was yesterday.
It's out already.
It's out already. Great. Yeah. So if anybody wants to hear more of Nikki, you can go see that podcast. And he talks a lot about that, right? I was listening to another podcast of his, and he talks about that, and that's a real issue. And when I'm thinking about how can we increase that rate, I think that's a positive of going to digital healthcare delivery. And so I wanted to get your thoughts more on how can digital delivery of behavioral healthcare actually increase the humanization?
Mm-hmm. Yeah, it's a great question. And I actually stole the 50% patient engagement stat from Stephen, and have had great conversations with him around it. But I think what's happened, Zach, is that we have gone and tried with remote technologies, right, and automated communications, but it is very much an impersonal means. And as somebody that's studied the psychoanalytic side of psychology, I believe in the relationship. And so personalized behavioral health treatment and personalized treatment where you're actually providing compelling interactions for behavioral health is critical. And I don't think it can be overstated that maybe one of the most prominent and predominant pieces of what we need to figure out is that patient experience. Because let's not make any bones about it here. It's not easy, the work. The treatment and working on yourself is difficult. It's painful. It's scary. And so a lot of resistance is not to be criticized. It's fear. And it takes a lot of courage to see people through that. And that's why, to me, the more we can do to really humanize behavioral health, where we're not just neutralizing it, right? I don't like when people say, let's just normalize that. No, let's celebrate and see what belonging and becoming and evolving to our best selves, like what's more inspiring than that? Like, I want to be the best version of myself I can be. Let's, put a sexy side to behavioral health.
Always for that. And that is a fantastic segue into our third shot on goal, changing the vision. In your mind, what is the utopian scenario of treating behavioral health?
So changing the vision to me is about creating a disruptive force. I feel like we need to reorient our values to seeing behavioral health in an exciting way, and one in which we really understand what is possible. And that does require us to find appeal, right? To boldly steer the industry, and also to make sure that we're shaping the future of behavioral health and its sphere. And to me, that means becoming the queen, of transforming behavioral health care and what we do about it. And that's where I feel like innovation enters, right? It's not about simply doing something different, right? It's about capturing the value and the genuine value. It goes back to what we think in a nutshell we need to see, which is creating, capturing, and delivering behavioral health value. And there's an overwhelming need to understand analytics and for an all-important lever that it can play, whether we're improving quality and efficiency or whether we're enhancing the value of behavioral health. And we need to center our efforts right there on technological solutions, on how that impacts the standing in the healthcare consortia through the strategic use of innovative capabilities. What we know is that the landscape is quickly changing and that behavioral health is no longer managing in some silo, right, or some vacuum. The payment mechanisms are actually rewarding now care coordination, and it's effective population management that's going to drive that. And to me, that's all predicated on interoperable and integrated capability. And so for me, designing the technological pathways that we can think about so that finally we're actually leading the service line of tomorrow. Right? We're no longer behind, we're no longer the laggards, but we're actually leading it. And so for me, if I thought about us as an industry, I would say as leaders of behavioral health, we have a unique opportunity right now to determine where we want our place to be in the larger care continuum. And I'm going to argue that we actually can be the greatest beneficiaries of that ambitious challenge.
Amazing, amazing thoughts. And that's an incredible vision that I could not agree more with, especially towards being able to provide truly better care to everybody. And somehow, Nikki, we are already 5 minutes over. I have no idea how that happened. Time just went by like that. So it's been just incredible to have you, to Nikki, and to know you. And I look forward to continuing to talk in the future. Thank you so much, Nikki.
Thank you.
And of course.
Thank you.
Of course. And with that, if anybody wants to hear more about Nikki and the space, we put the link to her podcast with Stephen in the chat that anybody can go check out. And so with that, I'm incredibly excited to introduce Simon Maurer, who is going to be moderating our panel. So Simon, please take it away.
Thanks, Zach, and thanks, Nikki. That was a super inspiring fireside chat, and I think the perfect context to speak to our esteemed panel. So let's hop right in. I think I don't think it needs any other context other than, look, for folks on the line, we will do a little Q&A session. So there's a box at the bottom of your screen in the middle that says Q&A. So if you've got a question for any of our panelists, please pop it in there and we'll be monitoring, and I'll do my best to get you by the end. But let's hop into our panel. So we have 4 panelists with us, and the first is Steve Bluemnfield, and he's the head of strategy and innovation for health benefits at Willis Towers Watson, which is a global human resources and consulting firm, and an anchor partner in Plug and Play's health vertical, amongst others. And Steve and his colleagues help companies to put in place healthcare and wellbeing programs, including support for mental health. And Steve, you're also a trained facilitator for the National Alliance on Mental Health. So really happy to have you here, and maybe you could tell us a little bit about the work that you do there, and maybe there's something you've been learning in the age of COVID around how to take care of your own mental health.
Yeah, thanks, Simon. Hi, everybody. Thanks for listening for the moment. Apologies if there's any noise in the background. We are on generator power. I'm sitting at the lovely confines of my bedroom, the one room that actually has some flow out from the generator. So sorry about that, circumstances in the Northeast as they are. I'm a former strategy consultant who became a healthcare consultant after having a couple of stops, both in the pharmacy PBM business and in the health plan business. And I've seen many sides of the solutions that are out there today. But I have personal experience, both families, particularly through 2 children that we had adopted from an orphanage that had pretty severe mental health issues, as well as some suicides related to the family, that led my wife and I to engage heavily in NAMI, the National Alliance for Mental Illness, and to become a trained facilitator, helping families to deal with the issues that we have been through. So we've seen every element of the behavioral health system and the mental health system, both on the side, frankly, from the medicines to the health systems that are providing the care, to the health plans administering that care, to the employers trying to do that, and then to actually living within the crises. In terms of what I'm doing, like everybody else, I'm trying to get by. So we can maybe talk a bit about that later. Thanks for having me.
Thanks, Steve. Absolutely. And next on our panel, we have Valerie Photos, and she's an operating partner at ISO Ventures, which is an impact-driven investment firm focusing on neuroscience and behavioral health. Valerie is a Harvard-trained clinical psychologist with a background in addictions and personality disorders. And she's also a pioneer in multiple sectors of behavioral health and innovation, translational research. Valerie, super happy to have you here with us this morning.
Thanks, and I'm happy to be here. And I've got a lot actually out of the keynote speaker, because at ISO Ventures, we call ourselves a brain health venture investing firm. And so what we've tried to do with our firm is to create the type of organizational structure that behavioral health needs to modernize, just like Nikki was talking about, for the next kind of 100 years. And part of the underlying principles that we think about all the time are the fact that the future of behavioral health doesn't need to look like just a kind of telehealth version of what we do now. So I'm a clinical psychologist. I don't expect my therapy that I do online or with people using apps or people using wearables or neurostem or anything to look like what I do in talk therapy. I think we should take talk therapy and make it what it is, because it works great for lots of things and lots of people. But think outside the box. I mean, psychology for the last 150 years has struggled with what counts as data. And we are in an age right now with the ability to measure things that we could never measure before. And so, the things I'm excited about with behavioral health are exactly what she said, which is shifting away from the idea that we've had in about the last 12 years in neuroscience, where there are circuits that are malfunctioning, and the point of behavioral health is to identify what circuits aren't working right and treat those. I think that as we're talking about racial justice and all of the COVID things and loneliness that are impacting us, like, we see that this is a much bigger and more interesting and exciting in some ways problem that hits at the core of why we live and why we die and why we choose to die and why we choose to live. And so just thinking about disease is not enough. So I'm excited. Thank you guys for having me.
No, I think that's a really, really good point. It's there's something around the solutions we come up with are completely determined by the scope of the problem statement. And if you reframe it as human flourishing and make it sexy in some senses, it changes the entire thinking around what the solution space is. So it's a great point. And stoked to have you here, and I can't wait to dig into some of these ideas. But you mentioned we're talking about data that we've never been able to collect before, which is a beautiful segue into Daniel Leong, who's the founder and CEO of Live Now, a seed stage startup that was selected into Plug and Play's Batch 9 in Silicon Valley's health program. And his team's the first to bring 100% passive, privacy-sensitive detection and tracking of changes in mental health states, helping employers and insurers and health systems deliver and quantify the value of science-based interventions, nudges, to support their population's mental well-being. Daniel, so good to have you here. And look, we'd love to get a sense of what's your day-to-day like, and how have you been keeping over the last few months?
Yeah, thanks everyone for having me here. Pleasure to be on this panel. I guess in terms of day to day, the past bit has definitely been a massive adjustment for me. I really enjoyed working in offices where I could interact with people, just kind of break up the day here and there. And that's something that can't really do nowadays, but definitely have been getting by. I think what we've seen so far is with COVID-19 going on, we've actually seen quite a bit of, I think our keynote speaker mentioned this earlier as well, and Zach as well. We've seen people prioritize mental health, and even employers and corporates make a bigger push on mental health lately. We've seen a lot of employers realize that the model of engagement, putting responsibility on the individual themselves, figuring things out and figuring where they can find help is a broken model. And so a lot of them come to us, and because our solution pushes down solutions rather than putting the responsibility on the users themselves. So that's what we've been seeing. We've been seeing people are actually starting to really care and look into mental health quite a bit more. And that's definitely a really great thing to see.
Oh, that's very interesting. I suppose maybe the connecting thread is that we've often viewed this as a downside problem to be managed, as opposed to a holistic down and upside opportunity to create value. So thanks so much for being here, Daniel. And finally, Amanda Giddon is the head of marketing for Monument, which is an online addiction treatment platform for those seeking to change their relationship with alcohol. And Monument connects members to expert resources, peer support, and licensed clinicians specializing in treatment substance use disorders. And Amanda, I'd love to know how you came into Monument, and what have you guys been seeing over the last few months?
Sure. Well, thank you so much for having me. I'm thrilled to be here and to have this conversation. So Monument is brand new. We officially launched in May after a several-month beta. So I joined the team nice and early back in November, and it's been really rewarding to be able to deliver telehealth services, especially now. We didn't anticipate this, but we feel really grateful to be able to provide care during this time. And the team is really focused on empowering our community and the global community to get more out of life by drinking less. And really, to Nikki's earlier point, celebrating what that get more out of life means. And we do that by holding ourselves accountable for improving health outcomes and connecting our members to top quality care. But personally, I'm really passionate about making the choice to change your drinking a point of pride and not of shame. And I think we have a lot of work to do there. And if I'm successful in my marketing role, on the brand and performance and kind of community side, that's my vision for the future.
Fantastic. Well, stoked to have you here. And so, look, for our audience, we're going to take this sort of in three parts. So we're going to talk about, how has mental health delivery changed in the age of COVID? We're going to shift to thinking about where are the big opportunities where technology can create value, and then we're going to think magic wand towards the end and take some questions. And look, as a human-centered designer, we often think of the best ideas having three sort of qualities. They solve a compelling user need, they leverage the best of what's out there in terms of technology, and they're sustainable from a business point of view. And to start off with, perhaps Valerie, maybe I could lob the first one at you. But in terms of, we heard a little bit from our keynote, but what have you seen from a clinical perspective, but also a technical perspective that's fundamentally shifted over the last few months as COVID has come to the fore?
So I think what shifted technology-wise is that people have a different relationship now with our screens and with our, use of everything that used to be considered a little bad. I mean, as a parent, I used to monitor the screen time that my children had. I would put 20-minute, kind of like buttons on their iPad. And now I spend my whole day in front of the computer. And I think with COVID, what's happening is that not only do we have to maintain our mental health, we also have to do this mental arithmetic about what's normal. And so because everybody is trying to think, is this acceptable? Like in this day and age, is what I'm doing acceptable? Is it the right thing? Is this normal? I think that all of us are actually doing a lot of self-assessment, and that we're getting really, really good at the basic principles of psychotherapy. And so I think a lot about, even today, I was thinking, should I go to the office, or will it look weird if I'm on, in downtown Boston? Like, what is the normal thing these days? And so I think with COVID in particular and technology, our roles are shifting with technology. Secondly, I think that our roles in life are changing. We saw the first responders with COVID that were in the hospitals doing every job in the hospital. It didn't matter what your role was or what you were trained in. You did what was necessary to help keep the patients alive. And so I'm noticing too is that in psychology, the technologists are just doing what it takes. They're becoming psychologists. I think a big pain point in technology and behavioral health has been that we have seen it as this kind of triad between patients, clinicians, and technologists. And I think that what's happening with COVID is that we're collapsing those roles, and everybody is becoming, in some ways, this like evidence-based medicine triangle of, there's clinical experience, there's patient preference, and there's data. And we're expecting the patients to hold all of that, and the clinicians to kind of act not only on like what works well in trials, but also what they can see from clinical experience, which is changing. Nothing that I learned in graduate school prepared me to treat health anxiety during a pandemic. I have no idea what to do. All I can do is go to the data that companies like Daniel's are providing for me and kind of make up the solutions from the ground up again. And so I think that shifting expertise is very, very important.
Valerie, you mentioned, sorry, go on, Steve, please.
Yeah, companies are really struggling with what to do with their people. I mean, all of us are living right now in a way that we weren't living months ago. And when we talk to companies about the reaction people had, instantly there was this just survival moment, right? How do we get through the day? How do we work? How do we care for our kids? How do we care for ourselves? This is technology work. So life changed overnight, and suddenly everybody paid attention to what people in the company had to say. And smart companies like we've got a podcast, Cure for the Common Co, and there's a great edition where we've got Marco Diaz, who won't mind me saying his name, from News Corp, a very forward-thinking employer, has a lot of digital health solutions as well as others on. And what he told us was that people were paying attention now. They wanted to know that they had a virtual health benefit. Yeah. They saw massive upticks in utilization of behavioral health tools they had already made available, whether it was digital tools. We've talked to startups and companies that are post-startup that are public, and indeed there was a merger today announced among a couple of them, seeing 100-fold increases, 1,000-fold increases in utilization. People need to get care. The traditional models haven't been working. So what's changed in COVID? It's created a trial moment when each of us need to figure out for ourselves what can be available to us, and then for smart companies, they're trying to put the tools they already have in place in front of people and put in new tools quickly to help them. Because you know what? As much as you might love to go to a therapist to have that session in person, it isn't happening. In most places, it simply cannot happen. And there's other ways. We've got to be more creative about scaling and then creating alternative modalities to receive that care.
Yeah, very interesting. And I mean, Amanda, you guys, I suppose there might have been a question mark last year as to building off Valerie's point. You know, is this just the digitization of a traditionally interperson, face-to-face interaction? But I mean, what are you seeing from sort of a patient point of view? Like, is there new barriers rather than new opportunities that are created from a treatment perspective, from an engagement perspective that you guys have seen as you guys have launched?
Definitely. So as I mentioned, we launched in May, and we've seen a real outpouring of interest in enrollments and also gratitude for us providing this service online. You know, I think we've seen two key groups emerge in our membership base, and that's people who have sought out treatment previously and their traditional coping mechanisms have been rendered inaccessible through quarantine and COVID. And then group B are people who potentially haven't identified a personal drinking problem previously, but all of the stress and anxieties that come with living through this time have potentially caused them to reassess their relationship with alcohol. So it's been very interesting to watch how those members engage with each other in our anonymous community. And we do offer anonymous virtual support groups, which have been extremely well attended in the early days, and also connect people to therapists who are specialized in treating alcohol use disorder. And Nikki mentioned earlier that 50% metric, you know, people who are getting care in the current system, and actually under 10% of people who have alcohol use disorder get care in the current system in a given year. So the response has been incredible. I think, you know, our therapists have adapted to the technology very seamlessly. You know, we do provide extensive training, and the member, you know, comfort with the technology has been more seamless than I had even imagined. And, you know, our program is very based in several modalities that have been proven to, you know, help people make progress and achieve their goals related to moderation or abstinence. So as long as we're sticking to that kind of therapy program and the modalities proven to work, we will be successful, and our members will be too.
Yeah, I mean, you're touching on something around, you know, evidence, and one of the things that I sort of studied as part of my health M.B.A. was the business case for telehealth, and sort of this sense of within many clinician communities that the jury's sort of out in terms of efficacy, or what are the limits of that, probably from the employer side, what's the ROI of really investing in these kinds of things, and really a paucity of just not enough data. And I think last week there was an article in the New York Times from Reed Albelson, which was saying that basically there's a big question about whether Medicare and private insurers will continue to cover virtual visits once the corona outbreaks subside. So Daniel, I'd love to bring you in.
That's not true. I'm sorry, just I'll let Dan answer the question, but in every major health plan covers telemedicine and has for years. Period, end of story. That's not going to stop. And in fact, even the president's announced this week that we're extending those programs. So there's a lot of what I have found a little bit puzzling is a medical community's a very bifurcated medical community. Those who are fearful of kind of an erosion of the traditional relationship, and then those who are embracing the fact that consumers like to consume things and don't want to have to do it on the terms of the person they're consuming from. So telemedicine is, as an industry, is extremely robust. It's not going away tomorrow. So I'm sorry, I don't want to take away the whatever question you asked Daniel, but I just want to clarify that there's actually numbers and facts behind that. I don't think that person that you're quoting was speaking to the data.
Well, I think the point was that there seemed to be an open question at the time, and commentary from you know, and a debate around the data. But I mean, this is in particular what I wanted to ask Daniel was, you know, I'd love to hear about how you are able to use the data and what data is able to be generated now, and the technical possibilities for helping employers, insurers quantify the value in sort of different ways of providing these kinds of solutions or services?
Yeah, so I guess like what you could compare us to that people are probably most familiar to is like your Apple Watch. So you know how an Apple Watch is continuously looking at how many steps you're taking, how much exercise you're doing, and just keeping track of your physical health and giving you nudges here and there to remind you to get off your couch, go for a walk, do some breathing. We're kind of the mental health version of that. So basically what we're doing is in the background, we're helping you keep tabs on your own mental health scores. And whenever we detect a change in your mental health scores, we'll look at what's available to you under your health and wellness or your insurance plan, what's clinically validated to potentially improve those mental health scores, and we'll deliver that to you in the form of a behavioral nudge. And so because we're doing that measuring in the background, we're able to help the ones who are paying for it understand what really works and what doesn't. Every time we deliver a nudge, we obviously take note of it, and then we look at over time, the more nudges we deliver in different categories, whether or not those are effective. We look at whether or not there's been a positive or a negative or no change at all. And over time, we're able to help the ones who are paying for it, as well as the individuals themselves, understand what works and what doesn't. One thing to note though is we definitely never provide any of the individual level information to the employers or whoever is paying for it. That's just a line that we don't want to cross, and we've taken multiple measures to protect our individual users' privacies. And a lot of the payers and employers don't even want this information because it introduces additional liability. So just one thing I wanted to kind of note.
That's important. So Danielle, just I'll point out that somebody asked a question on the chat.
Right.
Yeah,
okay.
sure. Look.
Yeah, just looking at it. Okay, so the question was, how are we measuring mental health scores? So what we're looking at is we're looking for changes in a person's behavior. We break it down into three kind of general categories, as well as one other, I guess, separate categories that's calculated from those three categories. So the three are a person's geolocation behavior, so how often they're leaving their house, what places they're spending their time in, how much time they're spending at work versus at home, things like that. And then their social behavior. So we use Bluetooth to do this. We look at how many people they surround themselves with. So how many phones are around them. And we combine this with the geolocation data. We look at how many, what phones we commonly see at different areas. And then from there, we put people into like phone IDs into buckets. So like, are you spending a lot of time with a lot of colleagues versus friends versus family? And we look for changes. The biggest thing here is we're looking for the delta, so the changes in a person's behavior. And then the other one is Apple Health and Google Fit-based data. So steps you take, all those, all the usual things. And then the last category that I kind of mentioned that we're able to calculate from all of this together is a person's circadian rhythm. So that's one thing that we're also looking into as well.
And so, Daniel, I'd be very curious, maybe I could lob this at Valerie and then Steve, but how are sort of employers with so we have a population that is clearly displaying or demonstrating a need for these kinds of services and a desire for these. We have technologies that's been matured to a point where we're able to collect different kinds of data. In terms of the business models, how are you seeing investors or employers or otherwise thinking about the ROI? What are they paying attention to in this space?
Yeah, the biggest thing is what they really care about is they care about creating positive outcomes, right? So obviously an employer and the payers are incentivized to create positive outcomes as they want their people to be healthier, productive, and to produce less claims for the payers. And so that's kind of what we as a company are focused on creating. So we think that the traditional engagement based model doesn't work. So we've decided to basically flip things around and push things down to people. And the kind of metric that we're looking at is the conversion rate. So how many people that we push behavioral nudges down to actually take action? Because many of these behavioral nudges or these interventions that we deliver, they're already clinically proven when people actually use them to be effective. So assuming that these are effective as they have clinically been proven, if people are actually taking them, we we think that people are like seeing positive outcomes. So what we've seen actually over the past 7 months of launch is we've seen that around 70 to 80% of people that we push nudges down to actually take the nudges. So that's what we're seeing right now. And it's too early for us to really measure like how much of a positive outcome we're creating at the end. But we're pretty confident that we're actually creating positive outcomes given the high conversion rates.
Yeah, potentially some good process metrics there. Valerie, what are you seeing in terms of the opportunities to create big impact right now? Where are you guys focusing?
Yeah, so I'll speak to that, but also speak just a little bit to business models, because what we find when working with really early stage companies is that they have a really fantastic kind of innovative idea, but they're needing help figuring out how to monetize and commercialize, and particularly around who's paying for this. And so I'm really curious to hear from Steve as well, you know, as a kind of, you know, an employer-based model, you know, we try to help the young companies understand that everything should be paid for, that offering free services is really dubious, because then the companies need to make money somehow. And if you're not paying for your service, the companies need to monetize in some way, whether it's ads or selling data or whatever. And so I try to really help people understand that there is a need for patients and or employers to pay for a service. It shouldn't be free. It shouldn't even be cheap, in fact, if it's something complicated. And I think that's really important for employers to understand too, is that you should be paying for your employees to get these services, and otherwise they're going to be skeptical about where their data is going. And so Daniel, I think it's great that you mentioned, you know, your privacy stuff, because if you look at the American Psychiatric Association's triangle of like how to evaluate apps, at that very basic level, it's who is running this, who's paying them, and you know, how are they funding this? And so I think that's a super important question. In terms of the sort of things I'm excited about, I think the integration almost, you talked about the nudges, and I don't know, Daniel, your company that well, so I apologize if I'm like misspeaking about what you're doing. I think that the integration of clinical expertise and patient desire is the kind of thing I'm excited about. I still want clinicians or somebody to be able to say, you need to work on this. I think a really important part of behavioral health is that we can't always understand our own needs, right? I mean, a part of mental health sometimes is that you are not aware of the patterns and behaviors that are driving the psychopathology. In fact, often you're not aware of the patterns that are driving your psychopathology. And so technologies that allow care coordination, that allow therapists or other experts, and have to be therapists, anybody, experts, to direct the patient or user, they're not always patients, the user to better health, I think is the types of technologies I'm excited about. So not just kind of quantified self where you're deciding for yourself, but also not where the clinician is the expert totally. Like you're your expert of your own health, but like a super important part of this is that behavioral health disorders by nature shield us from seeing some of the disruption that we have in our own lives. So it's not a question I can tell you about technology I'm excited about, but I'm more interested about this human factor stuff. Yeah.
Well, it's interesting. I mean, you're starting with different sort of segments, different sorts of, you know, clinical needs, and different kinds of technologies that can meet them. And Steve, I'd love to bring you in here and sort of ask you what have you been looking at in particular? What appears to be like high value space right now that you're directing your clients towards, or that you're looking in particular for your organization?
Sure, and I'll start by nodding a bit to the last two comments, and I think Daniel, you're right. It's a common belief that employers are always hungry for that return on investment, and of course they are, but they recognize that care is primarily what they're delivering through their benefits, and it's very infrequent you find a truly validated and clear return on investment. So you're looking for value, and value to your members. The need for behavioral health support, mental health care, emotional well-being is so massive, and we simply do not have enough therapists, prescribers out there to meet the need, period, end of the story, which is why innovators like Daniel, they can nudge people, you know, like Live Now, investing in young companies that can scale that care, I think are just wonderful ideas, help people to stop drinking. That points to a larger issue that Valerie hit on, you just hit on as well, Simon, which is the emotional well-being spectrum. That's how we think about it with our clients, because there is the need for care, and I agree, that having someone who's trained to help people understand is the gold standard in many, many cases. But people are all different parts of their spectrum, if you're trying to address the needs of a population, we know that, you know, a fifth or a fourth of those people are going to actually need some pretty significant mental health support at any given moment. That's just a fact. But the rest of the population needs something as well for emotional well-being, whether that is some kind of solution that can give them help with resilience or with meditation or nudge them to do something to get physical or whatever it might be. So to answer your question now, Simon, what we've studied over the last several years as this market has been evolving is the traditional models that were get you to a therapist, often with an EAP for an employer, an EAP, employee assistance program. This is one of the lowest utilized benefits ever. You know, a couple of percent of people to maybe 5% are using this in any given company, which means there's a massive need not being met. Then you might put in a behavioral health network to try to support people with care, but people aren't accessing those fast enough. And then we saw the telemedicine companies add behavioral health, and on the same time, we started seeing in emotional well-being companies adding resilience stuff, solutions, and meditation. And then this middle formed with companies that can triage and navigate and maybe deliver digital CBT, cognitive behavioral therapy, and other kind of tools. And as we're seeing, so our first question is, what's the problem you're trying to solve for your population? How do you get as much care to all the people across that spectrum as you can and as you can afford? And then the models we're seeing to emerge are those that span the whole spectrum, that actually let people do it all, let people give themselves some care and stay emotionally well, help them when they're pre-crisis, when they've got to maintain themselves, maybe through some digital tools that they can self-navigate, and then steer them to care, whether that can be remote or in person as they need, and of course to a facility if that's needed as well. So it's unfortunately a very large problem because we've bucketed brain health into one big bucket, when in reality it's many, many different things.
Yeah, that's a really good point. And look, as we've run out of time, but we'll head to the finish line here. But Amanda, I'd be very curious, just in terms of some closing thoughts. I mean, Steve hit on this this aspect that, you know, a lot of these services have been around for a long time, underutilized, and now there's been this wave of need. But I'm conscious that there's a bunch of people who've been probably relied on, you know, some of the more traditional forms, and now don't have access to them. And this concept, how do you make it easy for patients? How do you remove the barriers? I'd be really curious to hear, what are you seeing as being effective for getting these digital solutions, which are, I suppose, maybe the only thing that's available right now, or to where it's needed most?
Definitely. So we are laser focused on increasing access, and that means a few things to us, and there are a few key drivers there. I'd say one, right, not people drive hours to meetings, and that can be very helpful for many, but not everyone's able to do that. So bringing all of that care and expert treatment online is a huge way that we're doing that. Price, you know, there are free resources out there. We have a monthly subscription model, currently cash pay, and looking to integrate, you know, with insurance payments ASAP. But we've made that as affordable as possible. But to Valerie's point, not free, as we are connecting people to, you know, clinicians, therapists, and physicians. And then also, I think, as I mentioned before, the stigma piece, like, we are free of absolutes. You don't need to label yourself. You don't need to hit rock bottom to make a choice to live a healthier life. And that's something I'm really bullish on advocating for broadly. I think there's much work to be done, you know, for employers there, and understanding how we can encourage people to seek out those treatment options without making them feel like they're going to be punished for that choice, which will ultimately make for a more productive workforce, happier people, and you know, a better world.
Absolutely. And I think what I'm getting from you and from one of Valerie's comments is, you know, why couldn't this be a competitive advantage for companies, you know, to view that the mental resilience, wellness of their greatest assets, you know, should be top of mind, top of concern. Maybe just final comments here, Steve. There is one question in the Q&A, and I hope I didn't cause some confusion earlier. But the question is, a lot of companies are trying to cut costs during these times. How do we know, or do we know, the long-term ROI of offering employees mental health services?
Well, long-term ROI, I think that's a very, very complicated question. we regularly look at every piece of data available in claims and try to attribute back to, I will try to make this quick. The short answer to your question is it's really, really complicated to do that. And there's typically many comorbidities, so it's tough to say what is what, but here's what is absolutely clear. If you're diabetic, you also likely have behavioral health, mental health issues associated with that. If you've got a heart disease, you may also have that. Almost any condition has a mental health component, and then it's got its own component. So employers are absolutely clear there's value they need to invest here. The need is so great and demand so unmet that for many that will mean additional spending. But that spending will help in many, many other disease states. And frankly, it's part of why employers are doing this. So we don't generally see the question being one of price, though some companies only afford what they can afford. It's more, this is a need in their population. Nope.
Oh, I've successfully muted myself. And we're going to land the plane. But Daniel, do you have any final thoughts for folks who are wondering, maybe it's employers who are wondering, look, how might I use this? Could this provide value to me? How do you generally describe the value proposition for folks who are on the line who might be thinking about your company and those kinds of solutions?
Yeah, so with employers, a lot of the, I mean, like what these employers that are coming to us are looking for, they're looking for a couple things. One is they're looking to obviously help their population stay healthy, which is hard to measure at first. It definitely takes a long time to measure. And that's something that all our customers are very aware of. The other thing that they come to us looking for is helping them increase the utilization as well as efficacy of their existing resources. So because we're able to push down behavioral nudges that people that are tied to their health and wellness plans that people may not have even known about previously, we're helping them increase their utilization rate because we're pushing it down instead of relying on people to find things and figure it out on their own. The other thing is we're helping our employers kind of get a pulse in general of how their different teams are feeling, so that they can take so that they can push down decisions from like a manager level on how to better support their employees and what some employees groups might need more help with. So yeah, that's what a lot of our employer customers come to us looking for.
Yeah, interesting. So it's not just about managing the downside, but increasing group performance in some senses. So not necessarily, you can do the right thing while making money as well. And Valerie, look, as the clinician amongst us, perhaps give you the final word, but there'll be plenty of folks on the line who have friends who are dealing with, social isolation. Maybe you have some final words as we close out today's program.
Yeah, I was thinking about what to say, and I think just to give a piece of advice that isn't given enough, I think everybody should be talking to their friends about how they're managing their safety in COVID. Listen to your governments and your local governments about what their opening up plan is. Some people need to manage health risks in a way that requires them to stay socially isolated. Other people need to manage their mental health in a way that requires them to start joining social activities in the community again. And so there's a lot of available resources where you can think for yourself, what is the calculated risk that I need to take that might expose me to some COVID risk? In a very way, doing all of the masking, doing everything you should be doing, washing hands. But, if you are in a risk category, that means that you might have mental health problems, to really think about going out for walks, think about going to restaurants, think about going to see your family and friends and having conversations with them about what they're comfortable for too. I think that the major thing I'm seeing clinically is that lots of people are not necessarily we don't know when it's going to be over. And so they're sort of maintaining this level of isolation, sometimes needlessly. There are safe ways to get out and about if you have a physical health condition that is manageable. So talk to your friends, talk openly with your family and everybody out in your community what they're comfortable with, and get out if you can. And if you can't, definitely also talk to your people about who else is staying in and what they need.
Fantastic. Very, very good words. Thank you so much, Valerie. And look, to all of our panel, Steve, Daniel, Amanda, Valerie, really appreciate you spending the time with us. It was a really, really rich discussion, and I know it'll be valuable for so many of us on the line.
Thank you.
Thank you,
Thanks,
Simon.
everybody. Thanks, Simon.
Thank you, everyone.
Thank you.
I'm going to hand over to Zach to land the plane this morning, but looking forward to seeing you all in a online venue, likely soon again. Over to you, Zach.
Sounds good. Thank you, Simon. That was an incredible panel. And Valerie, to your point, there are things that we can do. I'm in an Apple launch competition, activity competition with my friends, which is a fantastic way to stay engaged. And even though we're 3,000 miles away, and obviously still beat them, which is so much fun and a fun way to converse with my friends. So definitely things that we can do to be social while also making sure that we're safe. So thank you for that final message. And with that, here are some of the program dates coming up. If you want to attend some of our other incredible events, we're going to be having our selection day on August 20th. And our startup program starts on September 9th, going through to November 20th with our Winter Summit, the incredible 4-day event from November 16th to the 20th. And you can see where you can sign on. As we go to what's next, we wanted to remind everybody of the mental health resources for you to always be able to keep in mind the National Suicide Hotline. The phone number is right there, as well as the National Alliance for Mental Illness, and you can call them. Both amazing resources that unfortunately have seen a spike in calls during the pandemic. And you can find a vast array of fantastic resources at Mental Health America, MHAnational.com/COVID-19. And with that, to everybody who has been listening in, thank you so much for tuning in. I think this has been just an amazing event. So happy that we did it. And please stick around to do this one quick question for the post-webinar service that we can continue to be providing amazing content for everybody in our ecosystem. And behind that post-webinar survey is my email. If any of you need to get in touch, I'm a resource for anybody who would like it. So with that, everybody, thank you very much.